In this video, I want to talk a bit about the acid-base balance in the blood. Maintaining a stable pH is a very critical homeostatic function in the blood because changes in pH can affect the structure of proteins, and since proteins are the workhorses of your cells, any change in the structure of the protein can inhibit their functions. So maintaining a stable pH helps keep your proteins and thereby your cells in good working order. Now, I just want to give you a super quick refresher on pH and acids and bases. pH is basically a measure of the log concentration of hydrogen ions in a solution. Completely neutral solution is a pH of 7. As you move down from 7, a solution becomes more acidic. And acidic actually means an increased concentration of hydrogen ions. So decreased pH means more hydrogen ions. As you move up from 7 up to 14, a solution becomes more basic, or sometimes that's referred to as alkaline. And this is a decreased relative concentration of hydrogen ions. So an increased pH means a decreased concentration of hydrogen ions. Pure water is completely neutral with a pH of 7.0. Arterial blood is typically at 7.4, about 7.4. Venous blood is a little bit lower at 7.35, and intracellular fluid is even lower at 7.0. Venous blood and intracellular fluid have a lower pH because of the presence of carbon dioxide as a byproduct of cellular metabolism, also from acidic metabolites, if there's lactic acid, for example. Imbalances in the blood pH are referred to as either alkalosis or acidosis. As you might imagine, alkalosis is when the pH is a little bit too high. So that's when the arterial pH is greater than about 7.45. Acidosis is when the arterial pH is a little on the low side, when the arterial pH is less than 7.35. Now, remember, pH depends only on free hydrogen ions. Hydrogen that is bound up with other molecules don't affect the pH. So when you're talking about acidosis, the blood becoming too acidic, where do those hydrogen ions come from? They can come from a variety of sources. You can have hydrogen ions coming from the breakdown of proteins. These breakdown of proteins form phosphoric acid, form sulfuric acid. These are referred to as fixed acids because they remain in the circulation until they're eliminated at the kidneys. You can also get hydrogen ions coming from anaerobic respiration of glucose, forming lactic acid, which dissociates to release some hydrogen ions, and hydrogen ions formed from fat metabolism and the production of fatty acids and ketone bodies. These are referred to as organic acids. And usually, under normal conditions, they're usually pretty rapidly broken down, pretty rapidly metabolized. They don't usually accumulate to significant levels where they can actually affect the pH. The fourth source of hydrogen ions is carbon dioxide. When you have carbon dioxide in the blood, that reacts with water to form carbonic acid, and then carbonic acid dissociates into hydrogen and bicarbonate. Okay, so if you have an accumulation of carbon dioxide, if you have too much carbon dioxide building up, you're going to have more carbonic acid and you're going to have more release of hydrogen ions, right? So this source of hydrogen ions is referred to as a volatile acid, or sometimes a respiratory acid, because levels of these hydrogen ions decrease in the body through gas exchange at the lungs. As you're getting rid of carbon dioxide, you're getting rid of that carbonic acid. Now, there are 3 ways that your body has of regulating pH, making sure that pH stays within a range that's conducive to normal functioning of your cells. First, I want to talk about the chemical buffers. The chemical buffers act immediately, essentially immediately, to any change in pH. These chemical buffers, this is the same as taking a beaker in chemistry lab and adding a buffering solution to keep that the fluid in that beaker at a stable pH. Chemical buffers are weak acids or bases. Now remember that pH is only affected by free protons, and really I'm being a little bit simplistic there, because technically, if you're being very technical, these free protons bind to water, and you get hydrogen ions. Hydrogen ions are referred to as protons because when they lose an electron to become ionized, all that you're left with is a proton. And when these free hydrogen ions react with water, they form hydronium ions. And if you're being really, really technical about it, pH is the ratio of hydronium ions to hydroxide ions, to OH negative ions. But it's only the hydrogen ions that are available to interact with water that contribute to changes in pH. So, if you have something like hydrochloric acid, HCl, HCl is a strong acid. If you put HCl in water, it completely dissociates into ions. 100 molecules of HCl gives you 100 hydrogen ions in solution. Complete dissociation. Weak acids and bases don't completely dissociate. So if you take a weak acid, like carbonic acid, and place that into water, some of the carbonic acid will dissociate, releasing a few hydrogen ions, but a lot of it stays as carbonic acid. So a lot of the hydrogen in that carbonic acid stays bound up, not available to form hydronium ions. So you have this dissociation equilibrium where you have carbonic acid in equilibrium with hydrogen ions plus bicarbonate. Okay? And if you add hydrogen ions to a solution, that's going to shift the equilibrium to the left. So some of those hydrogen ions will get trapped as carbonic acid. If you add a base to the solution and decrease the amount of hydrogen ions, that shifts the equilibrium to the right. And you get a release of hydrogen ions from the carbonic acid. So you can basically see this as the carbonic acid, or rather the bicarbonate ions from the carbonic acid, will sort of soak up hydrogen ions when the pH drops, when the amount of hydrogen ions increases. And when the pH rises, when the pH gets more alkaline, the carbonic acid releases hydrogen ions. Okay, so in this way, carbonic acid, like other weak acids and bases can, they help keep the pH at a relatively constant number. There are 3 major chemical buffering systems in the body. You have the phosphate buffer system, which acts in urine and intercellular fluid. This is based around phosphoric acid, which dissociates pretty quickly into dihydrogen phosphate, the weak acid, or monohydrogen phosphate, the weak base. So dihydrogen phosphate can donate an acid to become monohydrogen phosphate. And monohydrogen phosphate can soak up excess acids to become dihydrogen phosphate. This buffer system acts in urine and intracellular fluid. A low phosphate buffer system acts in intracellular fluid. The protein buffer system is the most powerful, the major intracellular buffer. The protein buffer system works because amino acids are weak acids. When a solution becomes more alkaline, the amino acids can release a hydrogen ion. When a solution becomes more too acidic, amino acids can absorb a hydrogen ion. Now, the bicarbonate buffer system, which is what we showed when I introduced chemical buffers, involves carbonic acid and bicarbonate. This is the only important extracellular buffer. Carbonic acid can release a hydrogen ion when the extracellular fluid becomes too alkaline, and bicarbonate can absorb hydrogen ions, can bond with hydrogen ions when the extracellular fluid becomes too acidic. In order for the bicarbonate buffer system to function, it does require having bicarbonate ions available, and this is something that can be controlled by the kidneys. The kidneys can control the reabsorption and excretion of bicarbonate. The carbonic acid comes from carbon dioxide in the blood, so the bicarbonate buffer system is closely tied to the functioning of your respiratory system. If your respiratory system isn't working, you're going to have an accumulation of carbon dioxide and an accumulation of carbonic acid. So talking about the bicarbonate buffer system brings us to the physiological mechanisms of regulating pH. Both your respiratory system and your kidneys help regulate pH. These are referred to as the physiological buffer systems because they involve functioning of organs. They act on a little bit more extended time scale than the chemical buffering system does, or chemical buffers can act immediately. Changes in respiration may take a few minutes to affect blood pH, and changes in renal mechanisms may take a few hours, but they can last much longer. Now, respiratory regulation acts by regulating the levels of carbon dioxide in the blood. As I mentioned earlier, carbon dioxide combines with water to form carbonic acid, and that carbonic acid then partially dissociates into hydrogen and bicarbonate. Now, both this equation and this equation are in equilibrium, okay? And so, since these are both reversible equations and they're both in equilibrium, if you increase the amount of carbon dioxide, that will push the equation, push this whole setup to the right, increasing the amount of carbonic acid and increasing the amount of hydrogen ions released from that carbonic acid. If you decrease the amount of carbon dioxide in the blood, that pulls this whole equation to the left, decreasing the amount of carbonic acid and decreasing the amount of free hydrogen ions in the blood. So your body uses your breathing, your respiratory rate, and depth to control blood pH. If blood pH drops, that means you have too high a concentration of hydrogen ions. So remember, your blood being more acidic, a lower pH means more hydrogen ions. Your respiratory rate adjusts, becomes more rapid and deeper to reduce the carbon dioxide in the blood, pulling everything that way and bringing that concentration of hydrogen ions back down. Conversely, when your blood pH rises, that means that you have too few hydrogen ions in your blood. Your breathing becomes slower and more shallow, so that you're holding on to carbon dioxide in the blood, which is going to shift this whole equilibrium to the right and bring those hydrogen ions back up. Now, this cause and effect relationship goes both ways. Your brain can adjust your respiration when your blood pH is off, but if there's something going wrong with your lungs, that can affect blood pH. So, basically, blood pH can influence respiration, but problems with respiration can also affect blood pH. So measuring the pH of the blood can be a really quick way to detect potential respiratory problems. When you have an acid-base imbalance caused by problems with respiration, it's referred to as either respiratory acidosis or respiratory alkalosis. Now, this stuff should be reviewed from the respiratory system. Respiratory acidosis occurs when you have shallow breathing or poor gas exchange, meaning that you can't get rid of that carbon dioxide, so the increased levels of carbon dioxide means more carbonic acid and lower blood pH. So if you were to test a patient's blood, you'd find a low pH and a high partial pressure of carbon dioxide. Okay, respiratory acidosis can be problematic. It can lead to a sensation of breathlessness or restlessness. If it gets severe, it can lead to lethargy, tremors, and even coma. Respiratory alkalosis is caused by hyperventilation. So you're breathing rapidly and deeply and you're getting rid of too much carbon dioxide. As the carbon dioxide in your blood drops, you get less carbonic acid and you get a higher blood pH. This can lead to dizziness, confusion, convulsions, and again, disruption of the nervous system to the point of coma. If you were to test a patient's blood, in respiratory alkalosis, you'd see the opposite. You'd see a high pH and a low partial pressure of carbon dioxide. Respiratory alkalosis isn't usually primarily a respiratory problem. Respiratory alkalosis, usually the problem is whatever's causing you to hyperventilate. So that may be pain, that may be some kind of stressful situation. It's what's causing the hyperventilation, not usually some problem with the respiratory system. Respiratory acidosis, in contrast, is primarily a respiratory problem. Something's going wrong with the lungs that you can't expel your carbon dioxide. Now let's bring the kidneys in. The kidneys work along with the respiratory system to keep a stable pH, although, like I said, they act over a bit of a longer time frame, hours to days, instead of the minutes that your respiratory system can act in. So the kidneys control pH by controlling the amount of hydrogen ions or bicarbonate ions that are released in the urine. If the blood is too acidic, acidosis, your kidneys secrete hydrogen ions, reabsorb more bicarbonate ions, so they hold on to the bicarbonate. They also generate new bicarbonate ions and release them to the blood, and this happens in a couple of different ways. You have carbonic anhydrase enzyme acting in your kidneys that releases or that secretes a buffered hydrogen ions and so it releases hydrogen ions into the urine and bicarbonate ions to the blood. It can also happen through metabolism of the amino acid glutamine. When glutamine is metabolized, you get ammonium ions secreted to the urine, and for each ammonium ion that's secreted, one bicarbonate ion is released into the extracellular fluid and returned to the blood. In alkalosis, the cells of your collecting duct, the intercalated cells of your collecting duct, secrete bicarbonate and reabsorb hydrogen ions. So basically your blood is too alkaline, so you get rid of some of the bicarbonate and reabsorb hydrogen ions. Respiratory acidosis is the most common cause of a pH imbalance in the blood, but metabolic acidosis is the second most common type of pH imbalance. Metabolic acidosis is basically a catch-all term for all forms of acidosis except respiratory acidosis. Right? So metabolic acidosis is basically any form of acidosis other than something caused by too much carbon dioxide, which, since it's a catch-all term, there's a variety of causes. The most common forms of metabolic acidosis are where you have lactic acidosis, accumulation of lactic acid, or ketoacidosis. And ketoacidosis is an accumulation of ketone bodies that are formed during uncontrolled diabetes or during starvation. Less frequently, you can get metabolic acidosis from overingestion of alcohol, because alcohol is metabolized to acetic acid, or during diarrhea, because during diarrhea, you're getting rid of bicarbonate ions in your feces. So you have an imbalance between hydrogen ions and bicarbonate ions. Kidney failure can also lead to metabolic acidosis, because if you have kidney failure, you see impaired secretion of hydrogen ions. Your kidneys can't excrete excess hydrogen ions, so they accumulate in your blood, leading to acidosis. Now, typically, if you see metabolic acidosis, if you were to test a patient's blood, you'd see the low pH, but you'd see low bicarbonate levels. Okay, not necessarily any changes to carbon dioxide, but low bicarbonate levels. Metabolic alkalosis is pretty rare, much less common than metabolic acidosis. It can be caused if you have loss of stomach contents, like multiple episodes of vomiting. Remember that if you think back to the digestive system, think back to the stomach. As hydrochloric acid is released into the lumen of the stomach, those cells that make the hydrochloric acid release bicarbonate ions to the blood. Okay, so hydrogen ions are secreted into the stomach, bicarbonate ions are secreted to the blood. This is referred to as the alkaline tide. So if you're losing your stomach contents over and over, your stomach is trying very hard to replace those hydrogen ions, to replace the acid it's lost. So it's releasing lots of bicarbonate ions as part of that process. And you can get, if your stomach's replacing large amounts of lost acid, you can get too much bicarbonate released, leading to metabolic alkalosis. You can also get metabolic alkalosis if you take too many antacids. With metabolic alkalosis, if you were to test a patient's blood, you'd see the opposite of metabolic acidosis. You'd see the high pH, as you'd expect with alkalosis, and a high bicarbonate content. If you put both renal and respiratory regulation together and throw in some bicarbonate carbonic acid buffer system, this is what you get happening during acidosis. Okay, if you start up here, during acidosis, you've got too many hydrogen ions, right? So those hydrogen ions, they bind up bicarbonate in the blood, making more carbonic acid, which converts to carbon dioxide and can get blown off in the lungs. All right. Meanwhile, those excess hydrogen ions can be absorbed by other buffering systems, but this carbonic acid bicarbonate buffer system is the most important one. And as far as in the kidneys, those excess hydrogen ions can be secreted. You also can get formation of bicarbonate and uptake of bicarbonate to help shift this equation. back over this reaction, back over towards carbon dioxide, and that can be released. In alkalosis, the problem is that you have too few hydrogen ions. So with the removal of hydrogen ions, will trigger dissociation of carbonic acid so that you get more free hydrogen ions released. For the respiratory response, you see decreased respiration, which builds up carbon dioxide, which kind of shifts this reaction, giving you more carbonic acid, which can dissociate, replacing those lost hydrogen ions. As far as the renal response, the kidneys get rid of some bicarbonate. They get rid of bicarbonate again, so pulling this reaction to the right. They also generate hydrogen ions and hold on to hydrogen ions, I should say, in order to replace the lost hydrogen ions. Now, the renal and respiratory systems don't function in isolation. Okay, they will compensate for each other. If you have something going wrong with your respiratory system that's causing an imbalance in the blood, your kidneys will try to work to correct that. Conversely, if you have metabolic acidosis or alkalosis or kidney failure that is causing a pH imbalance in the blood, your respiratory system will work to fix that, to try to maintain that stable blood pH that's needed for your cells to function. Compensation, while it's important to keeping you alive, it can make interpretation of blood pH imbalances very confusing. However, it's important to figure out what's actually causing acidosis or alkalosis. If a patient comes in with acidosis or alkalosis, you don't want to treat the symptoms. You want to find out what the root cause is and then fix that. If the root cause is respiratory, treatment will be very different than if the root cause is something metabolic. So in order to figure out what's going on, you need to know three things. You need to know blood pH, the partial pressure of carbon dioxide in the blood, and the amount of bicarbonate in the blood. These three factors are measured in a common lab test for arterial blood gases, ABGs. You need to test these substances in artery, often the radial artery, if it's got good flow, good circulation to it. If you test a vein, you'd just be looking at what's happening in the tissues that vein drains. It wouldn't tell you anything about what's going on with the lungs. Now, for respiratory acidosis, you see a decreased pH. It's acidosis, right? So your pH is low. And you see an increased carbon dioxide. If that respiratory acidosis is being compensated by the kidneys, you will see an increase in blood bicarbonate levels trying to counteract the acidosis. In respiratory alkalosis, you'll see an increase in pH and a decrease in carbon dioxide. If the kidneys are trying to compensate for it, you'll also see a decrease in bicarbonate. Metabolic acidosis, you see a decreased pH and a decreased bicarbonate. If your respiratory system is compensating, you'll see a decrease in carbon dioxide, okay, trying to blow off some of the excess acidity. If you have metabolic alkalosis, you have an increased pH, an increased bicarbonate concentration, and if there's compensation happening, you will have increased carbon dioxide. Distinguishing between a compensated condition and an uncompensated condition can be an important piece of information about what's happening in a patient. Compensation typically is seen when a condition is longer term, when it's been going on for a while. It's a more chronic condition. If compensation isn't happening, it's more likely to be an acute, short-term condition. This diagram is basically a flowchart for diagnosing an acid-base imbalance. It takes the information that I had in table form in the previous slide and puts it in terms of a dichotomous key. A dichotomous key is, well, it's like a flowchart, or you can also think of it as like a little roadmap that you take your data and you travel down along it to reach until you're left with only one possible conclusion. And it's called dichotomous because at each checkpoint, at each sort of fork in the road, you only have two options. For example, when you're looking at pH, your two options are acidotic or alkalotic. When you're looking at carbon dioxide, you have either increased or decreased. So if you suspect an acid-base imbalance, the first thing you want to know is the patient's pH. You check the pH of their blood. This determines whether you're looking at acidosis or alkalosis. All right? Once you've got that information, you look at the partial pressure of carbon dioxide. Okay? So let's look at the acidosis. If the patient is in acidosis and their carbon dioxide is either normal or decreased, it's probably metabolic acidosis. Right? If their carbon dioxide is increased, it's respiratory acidosis, and likely due to hypoventilation or poor gas exchange. If it's respiratory acidosis, you check the bicarbonate. And if the bicarbonate is normal, that means it's acute, it's uncompensated. If the bicarbonate is increased, that means that it's a more chronic compensated condition, like emphysema or asthma. Right? Over here in metabolic acidosis, with metabolic acidosis, the level of carbon dioxide can tell you whether it's acute or compensated. Acute metabolic acidosis will have a normal carbon dioxide, no compensation. Compensated metabolic acidosis will have a decreased carbon dioxide due to compensation, trying to get rid of the excess carbon dioxide. If it's metabolic acidosis, as I said, metabolic acidosis is a catch-all term. There can be a number of causes of metabolic acidosis. To try and get at what's actually happening, you can check something called the anion gap. And the anion gap is the balance between cations, positively charged ions, and anions in the blood, negatively charged ions. So under normal conditions, there's a little bit of a higher concentration of sodium is a cation, in the blood than there are anions. That's what you're looking at in column A here. Here's the quantity of sodium that you have. Here's the quantity of chloride plus the quantity of bicarbonate, and the difference between these two columns is the anion gap. This is normal. Now, if you have a patient in metabolic acidosis with a normal anion gap, that's what you see here. You see you have excess chloride, but lower quantities of bicarbonate, and that leaves you with the same size anion gap. This indicates that the cause of the metabolic acidosis is due to bicarbonate loss, which could mean diarrhea. If the anion gap is increased, that's what you're seeing in column B. You have normal quantities of sodium, but you have decreased quantities of bicarbonate and chloride. This is usually due to an accumulation of acids. So formation or retention of organic or fixed acids. So if you have lactic acidosis or ketoacidosis or renal failure, you're going to have an increased anion gap. So I've walked you through the acidosis side of this flowchart. The same idea holds if you're talking about alkalosis. If you have a patient with a high blood pH, you check the carbon dioxide. If the carbon dioxide is increased, it's metabolic alkalosis. If the carbon dioxide is decreased, it's respiratory alkalosis caused by hyperventilation. And then you check the bicarbonate levels to determine whether it's acute, which would have a normal or slight drop in bicarbonate, or whether it's more chronic, compensated, and you see a decreased bicarbonate level. Alright, after studying this video, you should be able to talk a fair amount about acid-base balance in the blood. You should be able to describe the buffering systems of the body, including what a buffer is. You should be able to talk about how the lungs and the kidneys aid in maintaining acid-base balance in the blood. You should be able to identify the 4 types of acid-base imbalance: metabolic acidosis and alkalosis, respiratory acidosis and alkalosis, and talk about at least some of the ways in which each arises. You should be able to say explicitly how respiratory alkalosis and acidosis arise, and talk about some of the ways that metabolic acidosis and alkalosis can arise. You should also be able to talk about how the arterial blood gas values play into determining the cause of an acid-base imbalance. So remember blood pH, carbon dioxide pressures, and bicarbonate concentrations. Lastly, but certainly not least, you should be able to talk a little bit about the idea of compensation. What does it mean to say that the lungs can compensate for kidney failure in terms of acid-base imbalance, or that the kidneys can compensate for respiratory alkalosis or acidosis?